Hey everybody. They always say that you should start out with a joke. I don't have one because I'm not that funny of a guy. I'm funny looking, but not necessarily funny. So I do want to ask a question though for everyone. How many people in the room have completed 4 years of medical school? Raise your hand. Good. How many of you all feel like you've completed 4 years of medical school in your GSD journey? Right? So wearing both hats, I've had the privilege of working in the GSD population. For those of you that recall, I did work with Dr. Weinstein at UConn for 15 very rigorous months before the pandemic came and, the world shut down. But the most important role I have is actually this one, is I'm Lindsay's dad. And that's the most important job I have. Just like many of you all, I know I'm not the only parent doctor in the room. And which one is more important? This one 100% of the time. But nonetheless, despite my bald head, I still do have to wear two hats all the time. And one of those big things is, as a primary care provider, I'm board certified in internal medicine and pediatrics. So from the womb to the tomb, unless you're having a baby or a surgical emergency, I can more or less take care of it. But then what happens whenever your parent hat and your doctor hat don't always agree? So that's when I always encourage everyone to look at the clinical guidelines, whether you're the doctor, whether you're a parent, whether you're a patient, whether you're a caregiver. So we'll start out with what are clinical guidelines. So the IOM defines clinical practice guidelines as a statement that include recommendations intended to optimize patient care that are informed by a systematic review and assessment of the benefits and harms and alternative care options. That is a mouthful. But to me, this is more like a blueprint. If you're going to go see your primary care doctor or your primary care nurse practitioner in this day and age, what should they know? They should know the guidelines. What should you know as a patient? You should know the guidelines. What should you know as a parent? You should know the guidelines. Because how many people follow any GSD group on social media? And how many of you see bad information all the time? Okay? About a year ago, about at the time of the conference, my response was always, read the guidelines. You're getting 10-year-old bad information at this point. Because believe it or not, even in this day and age, not everyone reads the guidelines. And so guidelines are important because as a physician, they have a systematic review of all the literature. So I want to know what has happened in the glycogen storage disease since Dr. von Gerke figured out the first one back in the 30s. I think it was the 30s. So 30s, 20s, long time ago nonetheless. The second set is, what do I do about it? When should I monitor things? How should I treat this? Why is this important? And it's your job as a parent or a caretaker or a patient or someone with the condition to say, why is this important to me? Why do I have to have an ultrasound every year or every other year? Why can I not drink alcohol? Okay, how many GSD people older than age 21 have had alcohol? Okay, exactly, okay? So it's one of those things, we know you're going to. How do I do it safely? Why do I know I shouldn't do it? And why are all of us parents going to go, seriously, you just did that, okay? So what are the components of credible guidelines? So this is the classic table. As a doctor, I'm almost obligated to put up here of basically summarizing my entire talk in one slide. So if you're looking on the YouTube channel, you go back through, pause on that one, because we're going to go through the different types. So the most important thing for a set of guidelines is whoever's writing them should probably be an expert. Okay, makes sense. We have a lot of experts in the room today. That's one of the beauties of the conference, is that we can walk around and I can talk with the writer of the guidelines. I can talk with the first author, the second author, the 11th author. I can talk with, people who are experts in other countries, like Dr. Dirks is here with us today, okay? I'm gonna be following him around tomorrow again, okay? I can talk to the other ancillary fields like our dietitians, because they're all over here and spread out throughout the room. And so, again, the question is, why are these important to me as an individual? Because guidelines refer to populations. We're a population of people. Out of our population of glycogen storage diseases, we have more than 14 types. Out of those 14 types, a lot of people fit in this one. Look at your little dots. We have a lot of blue dots, we have a lot of purple dots, and then the dots really go down in number after that, okay? So to be an expert in this, you have to be an expert in all of it. So you really have to understand, why does a carbohydrate metabolize the way a carbohydrate metabolizes? As a parent or someone with the disease, you need to understand a basic understanding of that as well. You know, one of my favorite pimp questions for the medical students is, well, in 1A, you can't burn your carbohydrates. What do you burn after your carbs? Anyone who's taken a nutrition class, you burn your carbs and you burn your fats, right? What can you not do in 1A? You can't burn your fats because you can't make ketones. I'm not going to bore you with biochemistry, but then that means you have to be burning something, which is the everything else, including your muscles. So that's why you have to have experts in all this to be able to understand all of this and be able to put pen to paper to be able to explain this to the doctors in primary care, who's your first contact with a lot of times on things. And then as a patient or an advocate or a caretaker to take the next level and understand. Incorporating patient perspectives has been a big proponent for the guidelines here lately. I don't care if it's for hypertension, the glycogen storage diseases, heart failure, the AHA guidelines are even all adding patient perspectives now. We have a lot of advocates in the room right now. Okay, we have a lot of people with connections to things just beyond the AGSD. We have people with connections to NORD. We have people with connections to rare diseases all over the place. We have people in other countries. And the patient perspective is so important, and which is, this slide is one of the reasons I'm going to be following around Dr. Dirks, because he is one of the people who's really pushed patient perspectives are so important when it comes to incorporating this. Because at the end of the day, what is your endpoint for how well your GSD is controlled? Is it your sugars stay good? Is it you don't need as much cornstarch? Is it that you can sleep through the night and not have to wake up? Is it you can have that champagne at New Year's or a wedding? What is important to you? And what is important to you is not going to be important to you or to you or to you or to you. And so we have to figure out, what should our endpoints be whenever we're looking at all of these things? Because if I'm your primary care doctor sitting down in front of you talking about this, my first question is what's important to you? So that's always the million-dollar question in a lot of these things. Evidence-based. Anytime we can have evidence, we should always have research to prove what we're saying. Now, in the rare diseases, we're never going to be able to have 100,000 people go through a trial. We can't, it's not going to happen, okay? There are 1 million people total with it, okay, with 1A in particular. How are we going to get 100,000 people to do it, okay? So at the end of the day, we have to not only use the research that we've got, whether it's observational or small numbers, but we have to have expert opinion. And this is where it becomes so important, is for everyone to have a seat at the table. We have to hear from the cardiologist, in addition to the metabolic specialists, in addition to the endocrinologists, the geneticists, the dietitians, the pulmonologists, everything along the line that is affected. Because everyone brings a different part to the story. Now, my talk last year in Orlando was, how do you get all these parts to meet? And I believe Dr. Ward is talking about how do you deal with it when they don't all agree. But what's important for you whenever you're talking to these people is that you know the guidelines. Because if they don't know the guidelines, by all means, give them a copy. I used to love it when I was doing primary care pediatrics. People had some weird disease whose name I couldn't pronounce. They'd say, oh, here's the guidelines on it, so that way you know what to look for. Guarantee it went in their chart, and I went home and read about it that night. Chances are your primary care doctor does too. So grading recommendations. Any good guideline will say this is a number one evidence-based, and they'll have some sort of system along the way. In the medical literature, there are several different systems that people use, so I'm not going to bore you with all of those, but the important thing is that the stronger the recommendation, the more evidence-based it is. The weaker recommendations come from expert opinion. And so again, we may have a small group of, say, 6 patients, let's say with GSD type 4, that say, look, we can do all this great thing with nutritional management. Then over here, from some European study, they might see, here's 20 patients where we transplanted all of our GSD4s, and here are our outcomes. Where does that evidence weigh? And that's where your expert opinion has to come in. So we also have to consider what are the outcomes and how are we going to do it? Because as a doctor, I can sit here and say, take 2 of these and call me in the morning. But how are you going to get your kid to take 2 of those little whatevers? Okay? As parents and caregivers and patients, we have to implement the plan. So whatever advice we're given, we have to make it doable. Now, one of the things in medicine, and I've seen this as a parent that we're guilty of in medicine, is we try to oversimplify things, okay? You really don't want to get up in the middle of the night and do a cornstarch dose at 3 o'clock in the morning, so let's just see if we can't stretch it to 6. It doesn't always work that way. Some people can, some people can't. You know, I know it's a pain to carry around a gram scale, so just mix up a couple tablespoons. That'll work. No, that's 5th grade math, okay? Solids are measured by mass, liquids are measured by volume. Cornstarch is a solid, no matter how you look at it. So what are the side effects we're looking for? What's the patient preferences, and is it cost effective at the end of the day? These are all things that we have to take into account to make it important. The most important part of all the slides I want you to remember throughout all this is recency. Because what good is it if I'm reading a guideline from the 1980s? Has the world changed since 1985? A lot, right? Has the world changed since 2011? Yes. Has the world changed since 2014? Yes. So they actually did the study, and this is my study slide out of all this, is that they looked at this, and the median survival time for an analysis was 5.5 years. And some groups won't even include, when they do the clearinghouse of guidelines, anything older than 5 years, the world's changed too much, we're not even going to count it as a valid guideline. So it's reasonable to ask that guidelines undergo review. We don't have to reinvent the wheel, but they need to be reviewed. And so what has changed? You know, if I think about, let's use 1B, for example. In 2019, 1B was treated with cornstarch and Neupogen. That is not how 1B is treated at this day and age, okay? It's completely different management. So, sponsoring society. The other thing to remember is, there's the old saying, follow the money, right? So, who is sponsoring it? Now, fortunately, here, our organization sponsors the writing of guidelines. And historically, this came about because nobody sponsored guidelines, and we needed to put something together to make it happen. Now, again, this is not an easy undertaking. I don't want to sit here and come off and say, oh, well, we'll just get everybody around the room at the bar down here. I'll get Dr. Corbel and Dr. Krishnani, and I'll get Kathy, and I'll get everybody here around the room, and we'll just go come up with guidelines. You have to do, it takes time, it takes effort, it takes money. You know, at the end of the day, to sit down and get these group of experts together in a room and to get them to agree, as someone whose current job is to get doctors to do things, I can tell you it's like herding cats, okay? So you just hope you don't get them too much in the corner and they bite back out at you. But to get people to agree, but that's what we have to come up with, is a consensus. And the guidelines should say, you know, some people feel this way, some people feel that way. In 7 to 10 years, we'll know something different. And so why is this important to you as a patient or a caregiver? It's because you know that things are going to change. you are writing the story right now. Those of you that know me well enough know that I love the adults with glycogen storage disease because they've lived it. Let that sink in. They've already lived it. As a parent of an 11-year-old, if I can sit down and talk to a 40-year-old with 1A, go higher. I wasn't saying that was the oldest, okay? I learned a long time ago not to talk about age in front of a room, okay? But let's say I could talk to a 50-something or a 60-something with 1A, okay? Because there's 70-somethings out there with 1A now, okay? These are the people that went through it at the beginning. They remember the cornstarch trials. They remember this thing called TPN they were playing with back in the day. I mean, there are people on social media, when you follow it, they're actually part of the cornstarch trials. I mean, think about that. Where were we at back in the late 70s and early 80s compared to where we're at now? Can you imagine taking care of GSD without a glucometer? Let that sink in, because they did. And there are people alive who took care of their GSD and they didn't have glucometers. All they had was their mama's nose. So again, that's recency, and I've kind of gone off on a tangent there. But this is why it's so important for us as an organization to support the writing of the guidelines. Because when we review these, we don't need to reinvent the wheel. We need to update what we found in the last, sometimes more than a decade. The other important part of any good guideline is you want to make sure there's no conflict of interest. Because again, follow the money, okay? Although as a GSD caregiver, I appreciate the work that industry is putting into things and the dollars that industry is putting into things. At the end of the day, industry cares about industry and they care about their product, okay? And whether that's true or not, the optics is, that's what the optics are. So that's why we have to make sure that any expert, because again, we have an X number of experts, and most of them, or a lot of them will say, do receive funding from industry on a consultant basis or their PIs or whatever, that's known. So that way at the end of the day that I can say, okay, this company sponsored this, so when they talked about this, this is kind of where that might have been coming from. And then as the doctor, I have to make sure it's fair. But more importantly, as the patient caregiver, you also have to make sure that it's fair. If I'm reading a guideline and someone has a patent on a certain treatment and says you should do this treatment first line, I'm going to ask questions. Okay, whether it's medically sound or not, it's reasonable to ask questions. So again, this is all the reasons why it takes funds to be able to do this. Different guidelines are going to disagree, okay? If you really dive into the GSD guidelines in particular, you have to watch which country you're reading from, because some are ahead of others. Some have been updated more recently than others. Some people love surgery for everything. Some people love diet for everything. Some people are kind of in the middle. And so it goes back to information is power. And no matter whether you're the doctor, the caregiver, the person with the condition, to be able to understand the difference between all these things is important, because at the end of the day, they're trying to write a story as well for you to be able to follow. So guidelines of clinical practice. So as the doctor, you have to remember, they don't replace clinical judgment. You know, sometimes you have to look and say, yeah, you know, do I go up on the 3 a.m. cornstarch or the 11 p.m. cornstarch? Or can I wait the full 6 months to check another set of triglycerides? Guidelines are blueprints, okay? But blueprints are how the houses are built. Even today, I was looking at a house in my neighborhood in South Carolina that's for sale, and I'm like, that's the exact same blueprint as what the house that I live in has. Downstairs is the same, the dining room's in the same place, the staircase is in the same place, but you go upstairs, they've got an extra bedroom, and I spent probably 20 minutes trying to figure out where that extra bedroom was. Because it's just a little bit different. Just like as an individual, you are a little bit different. Again, guidelines refer to populations. Not everyone's going to fit into a single population. And so we have to take your individual variables into account. So how do guidelines affect practice? Drastically, okay? Medicine, I'll be as politically correct as I can. Medicine tries to stay as cutting edge as what it can, but by the time it disseminates down to the person on the front lines, it can take a decade, sometimes longer. Most physicians, whether they want to admit it or not, practice the same way they did when they finished their residency. As someone now who's 20 years since they finished their residency, I work hard not to be that person, okay? But the lay people do. Unless you are on the cutting edge of research, you're at an academic institution making the research, not just reading the research. This is why most people feel like they've gone through 4 years of medical school in their GSD journey, because they've had to convince their primary care doctor, this is what I think is going on. They've had to convince an ER doctor when they're on vacation, no, I really need D10, okay? D5 won't cut it. This is what needs to happen. This is why, as a parent, you carry around a 3-ring binder about this thick with everything you could ever need when you go on vacation, just in case something happens. We've all been there, okay? If you can say, the guidelines say this, people are more likely to listen because it's not you. This is the consensus group of experts. And so sometimes you have to educate people along the way. Some people are more prone to listen to education or not. Some people are more prone to be educated by their patients than others. But the important thing is that you now have evidence to back up your advocacy. That's why guidelines are important. So as a parent or a patient, it's important that you know what they say, because this is your story. It's the blueprint out there, but your story is individual and unique. And so at least by having the guidelines or a map to show where you should be going, what needs to be done, why you should be doing these things, lets you stay on top of things. Because not everyone can afford to go see their metabolic specialist every 3 months. Most people have to fly and travel to go see their specialists, okay? Because let's be honest, there are a handful of specialty clinics in the world for the glycogen storage diseases. A handful. Not everybody lives in the Research Triangle and can go to Duke. Not everybody lives in Central Texas and can go to one of the hospitals in Houston or up to Fort Worth or any of the places like that. We won't even talk about the West Coast, because how many people have to travel to the West Coast to go to the true centers? So what we do is we take the people that we trust that listen to us, that will look at the guidelines, and when I say, I'm falling out of the guidelines for this reason, we'll actually listen and take that into account. So anytime you see someone on social media giving bad information that you know is bad, refer back to the guidelines. Because again, this group and this organization, when it started nearly 50 years ago now, okay, this is our 47th conference, right? 46th conference. So nearly 50 years ago, that's why they got together, because nobody knew anything about nothing. And they got together and they shared their experiences. And we've grown from shared experiences. So this is observational data to, okay, let's find the doctor here at the University of Iowa. He knows something about GSD. Let's bring him in. All the conferences in Seattle, let's bring this fellow from Boston Children's out to Seattle because he's taking care of 2 GSD patients. Okay? Let's get this person involved because they're growing a program. That's how expertise comes around. Now we're to the point where it seems like JIMD has something every month on the glycogen storage diseases. And those of you that don't follow JIMD on LinkedIn or Twitter or something like that, I do recommend that because they're kind of funny sometimes. But they have good information out there. If you want to be cutting edge, you need to go to that as well. Plus, we need to help out each other. There are some people in the room with the ultra rare diseases that I'll say, hey, Here's something brand new that just came out, and I'll send it to you. Just because that's going to be important for you when you sit down and you talk to your doctor. Most importantly, these are the guidelines. And what I want you to see is, when were they published? So I went in order. Type 1 is in 2014. Type 3 is in 2011. Type 4 is new. In 2023, we just finished those. Thank you for all those who worked on those. 5 and 7 were 2021. And 6 and 9 were 2019, so just pre-pandemic. So remember, recency is so important. Things have changed completely. To me, I'm going to speak just on 1A because I'm no longer a GSD expert, but I'm an expert in my daughter's GSD, and I read a lot on 1A. So I'll talk to the 1A guidelines in particular here. So much has changed since 2014. They were talking about canine models look like it might be amenable to gene therapy. That was kind of the statement there, okay? Period. The type 3 guidelines say, look out for cardiomyopathy because it's more and more common as you get older, because as the people are writing the story, people are living old enough to get cardiomyopathy. People are living old enough to get the same stuff that everybody else gets, even though you're more prone to get those. Now, the other question I get all the time, and I'm going to head this one off at the pass before I get questioned on it. What if I don't fit into any of the guidelines? I'm undiagnosed. I'm clinically diagnosed. What you do is you pick the one that's closest to what you have, because the fundamentals are the same. They may not be exact, okay, but they're going to be close. So if I have a ketotic type of the hepatic GSDs, look at the 6 and 9. You may be undiagnosed, or you may have 14 gamma. You may have something crazy out there, what your genetics are. Pick something that's the closest. Follow those. Take those, because remember, you're writing the story, and until you and others have written the story, you won't have guidelines. So I'll stop there. Again, I encourage everyone to join the organization. I encourage everyone to donate and to help us update the guidelines, because you look at the most common types, especially the hepatic types, we're more than a decade old now, and the world has changed a lot in the last 10 years. So thank you, everybody, and I'll take any questions. All right, Blair? The question is, are there any plans to update the GSD-1 guidelines? And I will defer that to the AGSD because they were the sponsors of that. I'm sure there are. I know a lot of us would like to see it. I know the authors of us would like to see it as well. But again, this takes time, effort, and money. Any other questions? Wow, I did a great, yes ma'am. The question is, where can you access the guidelines? They're all free online. Every single slide I popped up there, I literally just screenshot off of that. So they're free. I have the 1A guidelines saved on my phone, on my tablet, on my laptop, because again, I'm in Minneapolis. I don't know any doctors in Minneapolis besides the ones in this room. So what if something happens? I have the guidelines in my pocket, okay? The funny story I'll tell you about that, even me as a doctor has to do that. On my birthday, I think it was 2017, we were out of town visiting my in-laws, and Lindsay got a GI bug, and what's GI plus GSD equals hospital stay, right? So we're at the hospital, and I'm saying, hey, look, no, I'm a board-certified pediatrician. I know what I'm talking about. This is what we have to do. And they Googled me and looked me up. Kid you not, as a doctor, you can't hide from anything, okay? They Googled me and looked me up, and I'm like, I swear this is what's going on, okay? So even as a doctor dad, I have to prove that I know what's going on and still advocate for my daughter. It doesn't stop. It doesn't matter what the initials after your name are. You still have to advocate day in and day out. All right, any other questions for me? Are there any plans to add to any others that are missing from that list? I will defer that question as well. You know, it's one of those things that as more and more information comes out, you know, more and more will come out, and you have to be able to have first of all, you have to have enough experts to be able to come up with a conclusion for things. Right now, we're still in the point where different centers treat things differently, different countries treat things differently. And so, you know, not only do I think we need things updated, but I would love to see guidelines for some of the other ones out there. So, you know, because again, for someone like me, not only as a caregiver, but as a doctor, if somebody walks in and they say, let's say they have Fanconi-Bickel, I would love to know what the heck to do with Fanconi-Bickel. Love to, okay? All I know is that here's these little snidbits in here. You know, the classic question is, you know how much GSD they learn in medical school? It's a table in a biochemistry textbook. Here's your 14 enzymes, memorize them. And there's a lot of inappropriate mnemonics to remember those enzyme names. So, you know, but it's one of those things that, you know, that's all that people are coming to the table with. So anytime you can supplement their knowledge, not with you, this is what the world's leading experts say on this condition, it goes a whole lot further. Chad, you have a question?
What would it take to have almost like a living document for a guideline, something like up to date, you know, that is constantly being updated? And I imagine your answer is going to be money.
Yep. So the question is, what would it take to have a living document that's almost constantly updated? In a perfect world, that's what I would love to see. I'm sure you would love to see it being a pediatric intensivist. I'm sure that Dr. Dirks would love to see it. I'm sure that all of my colleagues from Duke would love to see that as well, okay? Because nobody wants to keep the information to themselves. We want to be able to disseminate what works, what doesn't work. The problem is there is no way to do that yet. And even mentioning up to date, if you that's one. Up to date is an online resource that a lot of generalists use because it's this huge database of things. The GSD one is not that great. Okay, matter of fact, I would recommend not reading it. Go to the guidelines. Okay, because you know most of the things, it's on heart failure, and you have studies with hundreds of thousands of people, and they talk about different doses of medications and the differences between those. We're never going to have those. And so especially in the rare diseases, that's why we have to work together. That's why the AGSD here in the United States works with the GSD groups in the UK and in Europe and in Australia and throughout the world. Because at the end of the day, there aren't that many of us. And to be able to compile all that data, even just to do a natural history study for everyone that goes through, is a huge undertaking to be able just to compile that data, much less to access it and then to be able to do research on it. So yes, the answer is money and somebody to do it and the resources to be able for everyone to be able to add information and to be able to access it freely, extrapolate research and data from it, and then be able to publish it again. Those things sound easy, but really in today's world, it is very difficult. So, any other questions or concerns? Because I haven't looked at my clock, but I feel like I've gone over. So, shocking I talk too much. So, all right, again, thank you everybody for being here. It's great to see everybody again. I'm around all week if you have any questions about guidelines, what little bit that I know, besides everyone needs to read theirs and know where they're at. Google them, okay? Save them as a PDF on your phone, okay? Because you will never regret it. Read it on the airplane ride home, okay? Thanks, everybody.